Hello, good evening. This is Chaitanya Dandote back again. Uh, Today I would like to discuss a topic which is not related to the heart, but yet it has implications and symptoms same like heart uneasiness symptoms like angina and all that. First of all, at the very onset, let me confess and tell you all, by profession I am not a medical doctor. So I would always advise you for your symptoms and your disease, better consult your medical provider, medical service health provider, or your own professional doctor. These are just guidelines which I would like to share on for education purpose and understanding the symptoms and not getting misled. Now, today we would like to discuss, or I would like to share with you all, is that after my angioplasty, three stents were put in my right coronary artery in the year 2014. From 2016, I started a different type of a feeling. Like, I used to get warm feeling in my heart, under my within my chest and heart, and there used to be rise in the blood pressure. And more often than not, I used to feel that there are some unexplained stinging pain, sometimes in the right side of the chest, sometimes in the left side of the chest, sometimes in the middle of the chest, and I used to get anxious. And this anxiety used to drive me further crazy by raising the blood pressure high and heart rate very high. I strongly recollect a situation where in Thailand I was in a exhibition hall promoting our company products, and I was discussing with the customer. Uh, I got this pain and warm feeling, like as my cardiologist had always suggested and advised me. More often than not, I troubled him a lot. He used to say, "Just calm down, relax, take an antacid, don't worry, don't think anything, it will go away." I followed his instructions many times, but on that particular day, after waiting for even 15 minutes, I could not get relief. I did not get relief. And then I asked my staff to get the medical help from the exhibition center. And the medical help soon came, and they checked my blood pressure and found to be 185. And my heart rate was around 120, 122, something like that. I was taken to a hospital. Prior to that, we were waiting for ambulance. That time again, when they checked my blood pressure, it was 232. 232. More than very, very normal range, and blood pressure which will make you worry. I could not, my heart rate was 155. I could not hold a mobile in my hand. Both the hands were shivering. I was taken to hospital in outpatient department, emergency ward. There was a young doctor. He checked for my EKG. My EKG weight came out to be very normal, absolutely normal. He checked my 2D echo also. It was again normal. Then I told him I want to go home. If EKG is normal, he said there is no heart problem. I said I want to go home. He said please don't go now, because your blood pressure is still at a higher level, and if anything goes wrong in your brain vessels, and if it causes any hemorrhage, then I will have a lot of problems. So that he advised me to rest for a long time, for say about 2 hours or so. He gave me some IV and all those things, some blood pressure tablets also. And after 2 hours, My blood pressure was normal. It's not normal exactly. It was just around hovering around 160, and he told me you can go home now. I went home. During my travel back to home, I had lot of gas passing, and next day morning I was okay. I went to job, and this troubled me a lot. Why is it this? Because I have been facing this problem quite often. So I asked my doctor also, why am I facing, what is the root cause? Because being a research and development person, I have a tendency to know or find what is the root cause. It's in there in my blood. I can't resist it. Well, so I went on looking technical literatures and all those things. I wrote a mail to Dr. Caroline Dean, who is a magnesium uh, minerals, and she's an expert on that. And I got a reply from her that probably Chaitanya, there could be hiatal hernia, HAITAL hernia, and that can be only detected through endoscopy. Then when I came back to India, I went for an endoscopy check, and I found that the doctor told me that there is no hiatal hernia, but you have very minute ulcers in your stomach and stomach, and there is no need to worry about it. There is no need to worry. Very tiny ulcers. I said, okay. So what should I take? Then I was given an anesthetic, uh, antacid, antacid, uh, Mucane, and okay, I said, if it's minor, why should I worry for it? And like my cardio, who has always assured me that your heart is perfectly well, then why should I think about it? But then again, there was that feeling in my mind that why should this happen, and why should it give me a false indications of some heart issues? So when I checked on various sites, I stumbled upon Dr. Ludwig von Roemheld and his article on gastrocardiac syndrome. Now it is this gastrocardiac syndrome is also known by his name as Roemheld syndrome. He explains that after certain age, maybe I am plus 60 now, after certain age, people develop some food intolerance, or maybe in earlier age also, where the digestive system is not so very strong. But for generally after certain age, you generate some sort of an intolerance within your digestive tract. Now, this intolerance could be for many reasons, but most of them are food intolerances and particularly related to gluten intake. Now, we Indians have a habit of eating wheat in different forms like chapati, roti, naan, and other things, and also your bread, butters, butter bread, hard bread, soft bread. We never pay any attention to changes in our health and symptoms and try to correlate with our lifestyle and food styles. Incidentally, I was convinced with that article, and meanwhile, in July, month of July, when I was admitted in for COVID, first day I ate chapati. From second day onwards, I did not eat chapati, and my heart rate was absolutely normal. 85, 84, 87, 88, 85, 84. I did not have that bloating effect in my stomach, which causes a bloating effect. Now, this is also related to one particular disease of digestive tract, that is called as a celiac disease. Now, this celiac disease can be detected in two particular ways. One is TTG IgA test. It's a blood test. It is called as tissue transglutaminase test for IgA. And the other test is the doctors take a part of your tissue from small intestine for biopsy, and then they analyze whether your lining of small intestine or of the stomach, whether it has gone haywire or whether it is not working properly. When these linings don't work properly or when the linings are deteriorated, then the digestive juices flow and interaction with the food, dissolved food, does not work in tandem, or complete digestion is not possible. Now, wheat is having certain portion of gluten. Now, what is this gluten? Gluten, as the name itself suggests, gluten. Glue means something which is sticky. So, over the ages, this particular gluten, it has two particular proteins, different proteins. I won't go much into those details. This gluten sticks to your stomach lining, thereby hampering the digestive process, and the gases are generated which move upwards. Unfortunately, they do not pass through your normal process, but some of the gases move upwards and press onto diaphragm. The diaphragm then presses onto heart and lungs. Now, this causes a turbulence in the heart functioning in the form of increased heart rate and angina-like pain, and you become anxious. And once anxiety gets onto your mind, it further aggravates the situation. So, I stopped my taking wheat food in chapati form or any bread form for last 3 weeks, and I feel, and I'm confident and I'm feeling very good that I do not have uh, digestion problems. Secondly, I do not have very high increased rate of heart, or I do not get that warm feeling in my chest, which is also called as a heartburn. Now, heartburn and real heart problem are often very misleading. People who are with good health, they have a heartburn, but it may not be because of any digestive malfunctioning. It could be a real heartburn or real pain in the pain or angina pain. But people who have don't have a heart problem or may not have a heart problem, but may be having a celiac problem, a celiac disease problem, and they have this Roemheld syndrome, they will also exhibit the similar types of symptoms like a heart patient. So, how to distinguish this? First is to the patient or the person who is affected should all first consult his doctor and get the EKG done. If possibly a 2D echo also. That will reveal the best. If the EKG shows some sort of a variance, then probably it could be a heart disease. But if it is not showing any variance, the 2D echo is there good. The percentage LVA factor is also very good. Then a patient and the history of the symptoms, if known to the doctor, he will be in the right position to suggest you that you may be having some sort of a Roemheld syndrome. Please look into your food styles. Try to adopt a well acceptable food that can be easily digested in your system. Friends, we have formed one group, WhatsApp group. It's called as a Magnesium Advocacy Group, wherein we share the information, knowledge, experiences, about all related to health issues. Many good doctors are on this group. Many friends, relatives, people from abroad are also a part of this group. If you want to join us, you can join us on. Please note down my WhatsApp number +66 88 90 858 40. I repeat, +66 890 858 40. Sorry, the second one was slightly wrong. 8890, not 890, 8890 858 40. But please prefix with +66 because it's a Thailand number. Thank you very much.